BioBusiness is a business association for the life and health science sector on this island. Its remit is to provide an advocacy role based on the industry members that it has, but it's also there to support the sector. We have worked with government agencies and departments to identify key economic areas for growth. One of those key economic areas is assisted living and connected health.
For a lot of the challenges, it's a change in care pathways and a change management process. So, I'm working with Robert, and Robert is interested in changing his care pathway to make it easier for him to be able to manage more patients. There's a commercial gain, there's a time gain, there's a personal gain, there's sort of patient gain, but it's changing how people provide care. It's a different way of giving care.
I saw this quote and I couldn't help but put it up here. It's so many roads, so many detours, so many choices, and so many mistakes. And I suspect that's where most of us find ourselves right now in telemedicine and specifically, I think, inside this community of telemedicine, telehealth, e-health, etc.
What I'm going to do is take you through the journey that we've gone through from the time that we looked at this and said, hey, maybe you might have a business. Right now, we have the product, we have a limited number of resources to go, and we have distributors in those countries, and we're going to service the Irish market ourselves.
We came together early, we built strong relationships, and we continued that into the service delivery. So forming a consortium early to provide an integrated service is key. Having a set of core values and building that relationship and trust.
So let me explain to you what the scale of national is for Australia. We measure travel from east to west in hours of flight. It's 6 hours across the country. Our problem for health in Australia is that we are too big. We are too far apart. We are 22 million people spread across the circumference of this land.
Distance is no constraint. How widespread, and when I say distance is no constraint, I mean distance from the technology, creativity, and imagination that exist in Ireland can be in fact deployed in Australia and the US and Canada and around the world. So distance is no constraint.
Current and emerging technologies will transform healthcare, new ways of working for sure. Connected health is really about communicating.
This is what we're looking to achieve. We really do want to have a situation where the healthcare system is better able to provide proactive support to patients through providing of targeted information to professionals.
And then now I suppose it's recognising or balancing autonomy with interdependence and I suppose the personalised individual in family and community. Not just the virtual environment, but the virtual environment augmenting the real environment. We don't just want to have everybody sitting in front of computers in their homes. People do want to get out and about and engage in society, and how can virtual and augmented environments come in and support that?
And this, I think, in many ways is going to be the burning platform underneath the HSE and the government. Because when you're faced with a very common disease that is going to flood accident and emergency and occupy a lot of places, you either have two choices. You can either build more hospitals and employ more physicians and employ more nurses and employ more technicians, or you can try and do what you're doing a little bit smarter.
If I take, for example, the employers today are having to deal with sickness and absenteeism, and that seems to be on the rise as they put more and more pressure on budgets, etc. Is there anything within the connected health area which could actually look at addressing sickness, absenteeism, stress within the workplace? I believe there is quite a number of products in there which have a commercially viable business case.
What's different is that something rather strange is happening now. 2 years ago, telehealth, aged care, smart homes, not very interesting. 2 years from now, I would expect to see it will have quite a large takeoff.
2013, 1 trillion devices connected to the internet. How alarming is that? We're seeing technical data doubling in every 2 years. We're seeing data capacity tripling every 6 months. That's an alarming statistic.
We have too many objectives. In all of these systems, we're talking about let's provide more information to the doctor, let's make the nurse more effective, let's make the entire healthcare system cost less.
And what I'm proposing is we really need to talk to users and people really early in the process.
But if you get the hearts and minds of health professionals, and if they truly believe that what you're trying to do will be better, when you do get their hearts and minds, they do stay with you.
And by the way, I don't want another system. I can't interpret that. Look at those graphs, look at those plots. You know, I don't even know who is that, what patient is that, when was the last seen, what was the last HbA1c, what was this, what was that. It was all out of context. And that's been the response that we have largely got from our colleagues.
I actually with a GP consortium last week with 2 million patients, and they said to me, Peter, what we want is a technology device for our GPs, and all I want them to do is put a hand on a tablet, and from that tablet I can diagnose that patient. That's their future thinking. That's their view of how community care should be done in a GP practice.
There's no reason why Ireland can't hold an amount of digital content to cover off Europe or to cover off the US, or indeed in time to cover off Asia. And again, I think for people working in the connected health space, these are just interesting facets of the Irish economy that you need to be aware of, because it may not be relevant this year, but I promise you in the coming 5 or 10 years, this is all highly relevant to the businesses you're engaged in.
So we need to believe that it is inevitable, publicize our success, and as we invest time and resource into creating exports, whether it's through contact centers or consulting or through the communication about products, it's going to be fantastic in terms of Ireland as a resource for the world.
CASALA, Netwell and BioBusiness Connect, we collaborate. We put this conference together. There was nothing in this space. We put it together over the last 2 years, and this is the second one, and I think it's done better even than the first one. We're also collaborating here at CASALA with fellow researchers. We have Trill here, we have Clarity, we have University of Limerick, we have Queen's University, we have Ulster University. We work with all these guys, you know, so, and we make an effort, and you'll hear some new programs coming out from these guys in the future working with us. We're working with industry. You heard some of the stories. We're working with people like McElwain Smart and Connected Health, Wrigley Dolphin. We're working with seniors at home in ADA. So, you know, we're out there knocking on the doors and trying to get companies to come in. And I know there's a number of companies that have been sitting watching me apparently and watching us over the last few months and seeing how they can connect with us. So our doors are open. My mobile is widely publicised. My email is widely publicised. So, you know, give us a call.